Lisa works in a busy call centre. She has tough daily call targets to meet and all calls are monitored. The following day. A week later.
Okay, so as you know better, I'll give you a fit note for a week. Best thing is to follow my advice about your diet, and if you still know better in a week, I'll see you again.
Another week later.
The pain's just getting worse. There's no way I can go back to work like this.
How often do you see patients like this? Who, for whatever reason, don't feel able to go to work?
Okay, here's a fit note for another week. Come back and see me next week. We'll have your test results back by then too.
Okay, thanks.
The simplest thing is to write them another fit note, but then Lisa will have been off work for almost a month. Whatever the reason for the initial absence, once someone's been off sick for 4 weeks, the likelihood of them returning to work drops dramatically. For more on the link between work and health, take a look at our 7-minute piece, The Work and Health Connection. A lot of people worry if they're off sick. They worry about losing their job altogether, or maybe that their employer or colleagues won't be understanding if they do go back. The subject of work is not always explored in consultations, but why not?
Because talking to patients about going back to work is really difficult. That's why. Reasons are complex, and you just don't always know what's going through their mind.
But what about you? How often do you have conversations like these? Ever wondered how you could manage them differently?
Okay, here's a fit note for another week. Then come back and see me, and we'll see how you are then.
Okay, thanks.
Shared decision-making improves outcomes for patients by enabling them to actively take part in managing their own health. Shared decision-making has an important role to play in getting people back to work too. Cardiff University have come up with a new, simple shared decision-making tool about work and health, designed to make that conversation easier to manage.
Over a 6-month period, 32 GPs in 388 consultations evaluated the tool. Prior to using the tool, only 66% of these GPs felt fairly or very confident in negotiating a return to workplace with their patients. After 6 months of evaluating the tool, this confidence rose to 94%.
So how does it work? Well, it's short and will help you introduce the subject of work in a non-confrontational way. You can use it either when someone is unemployed or employed but off sick. And here's how. The tool includes some prompts which may help your conversations.
The pain's just getting worse. There's no way I can go back to work like this.
So, if I was to ask you how important it was for you to go back to work right now, what do you think you might say? It might help to put this on a scale where 1 is not important at all and 10 is very important.
Oh, I see. I'd say around 8.
Okay, so it's really quite important for you to get back to work. So if I asked you now how confident you were about getting back to work, where do you think you might put yourself on the scale of 1 to 10, do you think?
What do you mean?
Put it like this. Using the same scale where 1 is not confident at all and 10 is completely confident about going back to work, where do you see yourself?
The way I feel right now, I'd give it a 3.
Asking about importance and confidence will highlight the things which are either stopping or helping the patient get back to work.
Okay, so your confidence is really quite low. What might be your reasons for that score?
Well, I worry that my manager won't understand. He'll just think I'm slacking and wonder why I keep having to go to the loo. He'll wonder why I'm not hitting my targets and want to get rid of me.
Right. So it sounds like you want to work, but you're worried about not being able to manage your targets and being able to go to the toilet when you need to.
Yeah, I suppose so.
Whichever prompts you use in your consultation, you can follow up with a question about your patient's worries and concerns.
Okay. And what's your biggest worry about going back to work right now?
I just worry that I won't cope with the workload and they'll just get rid of me. I can't afford to be unemployed again right now.
I see. And what would need to change for you to be able to think about going back to work?
Well, trying to make the call quota with my manager breathing down my neck is hard enough. Never mind the stomach pains and diarrhea.
So if your call quota was reduced for now, you might be able to go back to work.
Yes, maybe.
This shared decision-making tool will make it easier to fill out the fit note too, and, more importantly, help you put your patient's employer in the picture.
Okay, here's a fit note for you to give to your employer. I've put here that you may be fit for work, but on reduced hours for the next 2 weeks, and that you need to have access to a toilet when you need it.
Okay, see what they say.
I won't put I need to see you again, but get back to me if you're struggling.
Ticking the may be fit for some work is often in the patient's best interest. It also lets the employer know that the employee doesn't need to be 100% fit to come back to work. Remember, it's the detail here that puts the employer in the picture and helps the patient feel in control. So the fit note makes things clearer for both the patient and their employer. It's your opportunity to communicate directly with your patient's employer. So why not add a bit of extra detail in the comments box? This shared decision-making tool can help record information, which both you and your patients can then keep and refer to again. You can also print it off so they can share it with their employer if they want to. In summary, it can help overcome misunderstandings about returning to work and make for a more effective consultation.
So, returning to work is now part of your management plan.
For some patients, this approach can be empowering, helping them self-manage and make their own decisions. So, give it a try and see how you get on.